and this subsequent randomized double-blinded study found L2 nerve blocks led to significant reductions in pain even at 30 days. A bit more drastic, but perhaps worthy of consideration in some cases, is the possibility of lesioning the sympathetic trunks therapeutically. This was performed in this 1996 paper at the L2 and L3 levels. Subjects who had failed to improve following a lumbar laminectomy operation underwent diagnostic local anesthetic injections at L2, L3 and L4, after which a total of 15 lumbar sympathectomies were performed. 11 of these sympathectomies were deemed to have led to a satisfactory outcome after more than 6 months. The 4 unsatisfactory results had all had less than an excellent response to these same injections. This tells us two things. Targeted sympathectomy can be an excellent option for those with severe chronic low back pain, and that response to local anesthetic injections can be used to identify patients likely to benefit from this procedure. Take this case study of a 69-year-old female who'd had a fusion from L3 to S1 for chronic lower back and bilateral leg pain. Unfortunately, while this operation helped her severe left leg pain, after the operation she developed 9 out of 10 severity right leg pain, which failed to respond to multiple injections, none at the L2 level it must be said, and a further 2 decompressive surgeries. After referral to a specialist pain centre, diagnostic sympathetic injections were performed, followed by radiofrequency lesioning of the L2 and L3 sympathetic chains. This led to a resolution of her pain and allowed her to cease 3 pain medications. Here is a close-up of a nerve, and in colour you can see the small nerves and vessels which insert into the periphery of the larger nerve. These small nerves are called NERVI NERVORUM and supply sensation to the larger nerve itself. Unlike the signals carried along the nerve itself, the signals from the NERVI NERVORUM are very likely to be transmitted along sympathetic nerves and are therefore visceral. This means that they're poorly localized, resulting in an aching kind of pain. So irritation of a nerve, even without compromising its function in terms of its ability to carry ascending and descending signals, can cause pain. And like other visceral pain, this pain can be referred in a somewhat predictable, if not always exact, pattern. Consider, for instance, the pain around the umbilicus which usually heralds appendicitis, or the left arm pain which can signal a heart attack. And the irritation of the NERVI NERVORUM around the larger nerves can be either mechanical, from direct pressure of a prolapsed disc for instance, or chemical, derived from inflammation.
Annotated and summarized, easy to share with loved ones. The description below the title for this video has these summary points.